Sam Sujatra to all our viewers. Welcome to our new podcast channel brought to you by Research TV channel. In this third episode, we will explore groundbreaking innovations and cutting-edge research pioneered by our exceptional scientists and researchers at I'm your host Rajeshi, and today we would like to welcome our guest, Dr. Saw, who is a senior lecturer at the Department of Artificial Intelligence at the Faculty of Computer Science and Information Technology. Her area of expertise encompasses biochemical engineering in biomechanics and artificial intelligence diagnostic technique in healthcare. Dr. Saw is currently conducting a research on NeoGuard, a device aimed to improve the current methods of diagnosing fetal growth restrictions, or FGR, and monitoring fetal growth status throughout pregnancy. We will be discussing the journey behind NeoGuard, its potential, impact, issues, challenges, and future outlooks. So whether you're a seasoned professional and an avid enthusiast or simply curious about UM's latest research advancements, stay tuned on Research TV and don't miss this episode. Good day, Dr. Saw. So basically small-for-gestational-age newborn is defined as having a birth weight below the 10th centile, and SGA can result from fetal growth restrictions, FGR, whereby the fetus actually fails to achieve the individual growth potential due to a variety of factors. And basically these newborn during the pregnancy phase or maybe after, they have a higher risk to certain complications or developing chronic diseases at a later age. So what is the global statistics in terms of SGA and also FGA?
Thank you very much, and thanks for the nice introductions.
So
SGA, small for gestational age babies, refers, like what you say, is we have birth weights. It's defined like the babies have birth weight less than 10 percentiles. So in globally, the statistics of the fetus having a SGA conditions is 10%. But in Malaysia, because we are following the WHO standards, but in Malaysia, after we compute our statistics, everything compared to the WHO standards, actually in Malaysia we have 17% of all of the pregnancies, actually the babies having the SGA conditions.
Okay, and I think can we also talk about how the percentage of it going undetected, the complications during pregnancy and whatnot?
Yeah.
Maybe a little bit more about that to understand the overall statistics.
Sure. So maybe I can just talk what are the current clinical practice in detecting SGA babies. So as we all know, when you are pregnant, you will go to hospital to do some ultrasound scans, right?
Yeah.
So through the ultrasound scans, we will have they will measure the baby growth, like the baby head circumference, how big is the tummy, to estimate the growth. Aside from that, we also will measure the blood flow in the umbilical artery, so as to see whether the blood flow is enough, so that we see whether the nutrient and oxygen is enough to pass through the babies for the growth. So, but using all these current techniques, there are actually more than 50% of the babies don't have these kind of indications. Okay, so especially in second trimester. Okay, so some of these indications will appear in the third trimester. So a lot of the babies, all these SGA babies, are undetected in the second trimester. So I would say it's like 50% of them remain undetected. Yeah, correct.
So basically, once it goes to the third trimester, it's really like a rush call.
Yeah,
a rush call, and having to make you
Any
don't have time
interventions.
to
Do any interventions or clinical managements to help to improve the fetus growth. So yeah, so it would be better if we're able to early to pick up all these high-risk babies, so that doctors can do some interventions or proper clinical managements to improve the fetus growth.
So basically, to mitigate this scenario in pregnancy, and to avoid small-for-gestational-age newborn, you are currently conducting your research on NeoGuard.
Yeah, correct.
So basically, it's a device and it's also an AI model, from my
Yeah.
understanding. But probably you could
Yeah, so
further expand.
So actually, this technology we started during my PhD time, where we wanted to do something to help these SGA babies. We know that the current technologies or the current detections techniques are poor. So with the using of these AI models, we are using the retrospective data from our hospital, PPUM hospital. We gather all the past 5 years data, and then we develop these AI models to early predict these conditions before birth, right? So we want to use this AI technology to kind of like pick up the undetected SGA babies, so that we can pick up them and then we can give some early interventions or clinical managements to improve their growth. Yeah.
So, I mean, is this still at a very early stage? Has there been like any sort of a reflection or a comparison made to, practices in other countries?
Oh, okay.
Or in terms of
So
like
in
NeoGuard?
in our current stage, we actually have developed the proof of concept. So we developed AI algorithm. The next plan we want to do is actually we want to conduct clinical trials in the hospital to see the feasibility of this technology when we really implement in the clinics and see how the performance, etc. In terms of working, sharing it with overseas, we are now actually discussing this kind of collaborations with like in UK university and also some of the university in China to see whether we can carry out some clinical trials, experiments, and use our technology and test on their populations. Because as we know, there have been studies show that if one AI algorithm that developed in the data coming from one countries, it may not be working well in other countries because of the difference in your data acquisitions practice. Because with different persons, we may measure the head circumference differently, the techniques. There's also due to some difference in ethnicity and genetics. So that's our plan. We are talking to hospital in UK and also China to see whether we can do these clinical trials.
So, when it comes to when you're talking about SGA, so FGR, what are actually the causes or symptoms of these for small newborns, and the kind of fetal growth restrictions that is the factors that are visible?
Yeah, so for SGA, as mentioned, it's because during the pregnancy they don't receive enough oxygen and nutrients. And we know that the placenta, which is the only organ that developed during pregnancy, is the main function is actually to deliver oxygen and nutrients to the babies and exchange the waste product between the mother and the fetus, right? So there is some problems happening in the placenta where the placenta does not do a very good job in exchanging the nutrient and oxygens. So that is why when that organ is not working well, the fetus do not receive oxygen and nutrient enough, so the growth will be kind of smaller. So that is one of the factors. There are also other factors like lifestyle factors. If you are smoking or if you are drinking alcohol, all these habits, it also will increase the risk of SGA and FGR. The third factors would be related to maternal complications. For example, if you are having a hypertension or you have diabetes during the pregnancy, this will also increase the risk of you having a FGA or FGR babies.
So, from my understanding is certain mothers, when they are pregnant, they do look at their sugar level and whatnot. So, is that also a contributing factor in one way, or that is just like an early precaution?
No. So every time when you go to the hospitals, they will do some standards procedure, that they will check your blood pressure, take your glucose level, all these things to see what are your risk factors. Yeah. So if you have, according to their clinical guidelines, they've mentioned very clearly if you have certain how many major risk factors or how many minor risk factors, they will manage you differently. Yeah. So But in our AI models, we incorporate all these different factors,
Okay.
and then we give them some different weightage so that we know that which risk factor is more important, that it can contribute to predict the baby at birth. What's the outcome? Yeah. So our technology is kind of like forecasting whether your baby at birth, whether it will be small or normal grown. Yeah.
Okay. And basically from I understand. Basically from the overall, from what you have said now, at what stage of pregnancy is NeoGuard implemented, or you begin evaluations, and how does it differ
Okay.
in terms of the clinical practice?
Currently, our NeoGuard is actually can be implemented as early as in the second trimester, which is around week 14. Yeah, because the AI model that we've trained are using the second trimester data to train the model, so we can input any features to the AI model using data coming from second trimester. Right. So how is it different from the current clinical practice? Current clinical practice is when you go to the hospital, you do scanning, you only know what is the baby growth at that particular time point, right? And then next week you come again, then we can see your growth trajectory up till today.
Okay.
But our technology is kind of like forecasting the future. So we want to forecast whether using your current data, like the ultrasound data, your risk factors, maternal risk factors, you want to forecast whether your baby at birth will be born small or not. So the difference between our technology and current clinical practice is we are able to forecast in the future what will happen to your baby. Yeah.
That's interesting. I think a lot of mothers, especially expecting mothers, they would really want to know whether their baby is on the right track of development, and so what are the other functions and benefits of NeoGuard?
Okay, so aside from our AI models, we also have an interactive growth chart. So currently, what I understand is we are actually using the head-load growth chart. Okay, that this head-load growth chart is actually based on Western populations.
Okay.
So which means that after they measure the baby size, they will compare to this head-load growth chart to see whether your baby is adequate growth or not, whether it's between above 10 centile, they use the cut-off value at the 10 percentile. But one problem for this thing is because we know that Asian people are much more smaller than the Western population, right? When you are comparing our growth to their population growth chart, it will not be accurate. So our another functions or features in our NeoGuard is we have our own Malaysian local growth charts. So we use our Malaysia data, which is again we are working with PPUM. We take the retrospective data from their database and we came out with Malaysian population growth charts. So in that NeoGuard, we also have our Malaysian growth charts. It will be much more accurate if we compare our growth to these Malaysian growth charts, so that it's much more representative.
So basically, when you're also looking at comparing the basically the Malaysian population, you're also taking are you also, is it only just like the physical growth of it, or there's also beyond, like the mental growth, and also making sure their organs and whatnot? So how does that come in? How do those factors come into the consideration for NeoGuard?
Yeah, that would be a very interesting area of direction that we can pursue, because currently we are actually focusing on just growth. Yeah, we because currently what we're thinking is we just focus on growth and then we establish that, and then alongside we can also explore like whether the mental growth, maybe they develop some autisms, or is there any other complications that the baby is going to have. But at this current time point, we're actually focusing on we're going to check out whether this baby is going to be born small or not. Yeah. But in the future, we can explore to some other applications. Maybe we can find out whether this baby is going to be preterm or even large, because large is also not that good. It will be giving problems to the mothers who deliver a large baby. So there are some things that we are also planning in the futures.
So basically with the implementation of NeoGuard, right? Who are the I would say who are the the people who would actually benefit from it? So we have the clinicians because they are the ones who are going to be talking about all these data, and also, and I believe it's the expecting mothers as well. So in what way is it like helping these two basically these two groups of people?
Yeah, so maybe I will talk about first the clinicians. So as for the clinicians, we know that they are using current clinical practice. So one of the challenges in identify FGR baby is first is based on those indicators, right? So if they really find out that all these babies have this indicator, sometimes it's a little bit too late, right? So very unfortunately is that there is no treatment for the late FGR, which is if you detected late in the pregnancy. So if you detect the FGR earlier, the doctors may give you some aspirins or some other drugs to help the growth of the fetus. So because our currently technology is we want to early predict the FGR babies.
Yeah.
So if we're able to predict early, then we can give some aspirins to the pregnant mothers or some other better clinical management so that to improve the growth. Second, for the mothers, I think it would be benefit to them because let's say the baby is predicted normal, okay, enough weight, not small, then you kind of like you give senang hati to the mothers, right? I mean, what the mother hopes is really the baby is healthy, right? So if it's like small, so then they can do some things to improve the baby growth. In terms of like I know that there are some milks that can help the growth of the fetus or this thing. You can try it out instead of just waiting and then let the baby starve inside the womb. Yeah.
And basically, I think so long we have been talking about what NeoGuard can do and whatnot. On that basis, does NeoGuard have the capacity and also like the support to analyze like the fetal growth of like more than a single fetus at a time, or is it just like for one fetus?
Currently, at this time point, we are just focusing on singleton pregnancy, which is only one fetus. Yeah. So the performance on testing on the twins, we do not know what's the performance yet, but it will be good if let's say we can find out. Yeah.
So so basically at this point, it's only focused on single fetus.
Correct.
Okay. Right. And so basically to sort of to have an overall summary, it's what are the future improvements that we can see on NeoGuard? Like, what is the next plan or what is the next stage? Like, because from what we have discussed right now, the NeoGuard is pretty much in its very early stages, and you're collecting data and you're doing a lot of comparison. What is the development like from here on?
So we have developed the proof of concept. So I think the next thing, if we really want to implement in the clinics, we have to go through some clinical trials in different hospitals to test the robustness of the technology. So actually, I'm also in search of different hospitals in Klang Valley. So if anyone, any audience who watch this video, so if you're interested working with us, welcome to contact me. We want to do some clinical trials in different hospitals to test the robustness of the algorithm, and then the feasibility, and then also the acceptance of the clinicians in accepting this kind of AI technologies, because it's kind of very new. So we want to see what's the feedback from the user, especially the obstetricians who are going to use this technology. So that is so far our short-term plans, at least for these 2 to 3 years.
Okay. And what are the kind of challenges that you see? I mean, I know you're going to have to approach hospitals and clinicians, and then you're also going to go towards the mothers and getting them to understand what the technology is and how beneficial it will be. So, like, what are the challenges that you see like in the implementation of NeoGuard itself?
I would say a lot of challenges, because first thing is you want to get a technology into the hospitals, so it's like a disruptive technology.
Okay.
The practice they have been, I mean, the clinical practice they have been using is established for years, right? So if you want to go and disturb the standard practice, you have to really prove that your technology first is robust enough, because this technology is related to human life, right? Human health. So it has to be very careful as compared to other AI technology. So I think some of the challenges I foresee first is really getting the interest of the hospitals in participating in the research. So that is one. The second is about the data collections and all these ethical approval we have to go through by all the levels, so that all the protocols are properly done, right? So after the clinical trials, I think the next step would be you need to go for, I think there's a medical device authority, MDA. We have to get the approval from Malaysia.
Okay.
Before you really can implement this kind of technology to be used in a hospital. So for me, I think it's a very long journey if you really want to see this AI technology to be used in the hospitals. Yeah.
What is your expectation?
I
In
think
terms of the timeline.
10 years.
10
years. I mean, if you look at others, technology and medical device or some drugs, they took average time is around 10 years. 10 years.
Full decade.
It's a very long journey. You have to persevere through the whole journey.
So, Dr. Saw, thank you so much for a very insightful session on NeoGuard. And that brings us to the end of today's episode. We had an enlightening discussion on NeoGuard, and firstly, I would actually like to thank Dr. Saw, for sharing your insights and also sharing your expertise. I think to have such a technology like NeoGuard being implemented at a time where health is actually it's a big factor of our lives, and when it comes into the aspect of bringing another life, it's equally important, whether it's for the mother, whether it's for the newborn, or even the families as well. So I think that to have this kind of technology, the kind of innovation that that you're about to bring is remarkable. It's something that I think we really need. We are actually looking forward. And to our listeners, if you are as excited as we are about this research, be sure to follow Dr. Saw. You can also find out more information, also updates on Research Bulletin about the projects, and also our social media channels. Thank you for tuning into Research Podcast. If you enjoyed this episode, don't forget to subscribe, to rate, and also to review us on YouTube. Your support will actually help us bring more impactful stories and also remarkable researchers to come. And until next time, keep exploring, stay curious, and never stop learning. My name is Rajeshi, and this has been the Research Podcast. Thank you.
Thank you.